In our morning rounds, marriage with health benefits. Couples vow to stay together in sickness and health. This morning, a new large nationwide study finds having a spouse can lower your risk of heart disease by 5%. CBS News contributor Dr. Narula is a cardiologist at Lenox Hill Hospital in New York City. All of us are single at the table, but I'm going to be listening with both ears to everything you have to say. So what is it about having, and we should say it has to be a good marriage.
That's right. So
a good spouse.
We've known about this concept of a marriage advantage since almost the late 1800s when it was first described to improve your overall survival. And now we're recognizing that it may be as important as traditional risk factors for cardiovascular disease. There's probably several reasons why this is so. One is married couples help each other to eat better, exercise, avoid smoking and alcohol. They serve as a buffer for stressful life events for each other. They encourage each other to take their medications, go to doctor's appointments, and they may even recognize symptoms that their partner doesn't. For instance, if one partner's snoring at night, the other partner may encourage them to seek help for sleep apnea.
If you're single, the only way you know you're snoring is if you put on a tape recorder. No, was that me?
No, not necessarily.
Really? I think I'm turning maroon.
Do you ask
Clarissa.
your patients? I'm in there,
Yes.
I'm saving it. Do you ask your patients as a cardiologist about their marital status
Yes.
or their relationship status?
So every doctor in training, we're taught to ask a social history, which means to get a sense of, are people single, divorced, do they live alone? And patients often look at you and wonder why you're asking that, but it's because it plays into what's going on at home, your emotional and family life, and how well you're taking care of yourself. So it should not just be asked at the initial visit, but it should be asked at every visit, because life changes happen throughout your course of time with a patient.
Well, it seems important to understand why it is that marriages deliver these things. And then ask yourself, how can I make sure I have those things in my life?
That's right. And I think, as Gail mentioned, the quality of the marriage is extremely important, especially for women. And, you know, we know that if the marriage is not good, it can increase stress, it can increase blood pressure, cause depression, which can lead to cardiovascular disease.
I had one of those. So I had one of those stressful marriages, but we won't go into that. So does it benefit men more than women or women more than men?
It seems like the benefit, at least in this survey, was for both men and women, although some research in the past has shown that the survival benefit may be more for men, probably because men tend to be more isolated and they rely on their wife a lot to take care of them, whereas women tend to be more social and have more bigger networks of support. The quality of the marriage, though, is probably more important for women.
I think so.
All
I think,
right,
Clarissa,
well.
one of us should marry Charlie this weekend.
I know.
Shall we flip?
I'm sure my boyfriend would love that.
I would say
Don't take it personally, but all right, Dr. Narula, thank you so much.
Thank you.